Hey guys! So a little bit of a change of pace here. Normally Miss Hurlis is the one who reads through these news ELA articles, but since Miss Hurlis was reading through the Hinduism quiz, I thought that I would take the news ELA article this time. So we're going to be reading an opinion piece. And so before I even start reading this and we start going through it, I want you to keep in mind that this is one person's opinion. And a lot has changed since this article was written. A few things to notice. The title says opinion. Fear about the coronavirus is normal, but don't let it control you. And it was written by a man named Gideon Meyerowitz-Katz in a newspaper called The Guardian, and it was published here on March 9th. So we know that that's been over a month, and a lot has changed since then. So keep that stuff in mind when we're reading this article. It even says here, it says, editor's note, this opinion article first ran in the Guardian newspaper on March 3rd, 2020. In the time since its publication, coronavirus guidelines provided by health organizations such as the Centers of Disease Control and Prevention, CDC, and the World Health Organization have changed significantly. Around the world, updated guidelines call for people to shelter in place and to wear a mask at any time they enter a public place. So again, keep in mind, this is just one person's opinion, but it's important that we read these kinds of things because you need to get used to being able to read opinion pieces, read them objectively, and kind of put your own thoughts on that piece, remembering that this is not fact, it's just a person's opinion, and opinions are like noses, everybody has one. So we're going to read through this article together, follow along with me, and then I will read through the questions at the bottom, and then you guys can kind of do your own thing. So here we go. The novel coronavirus, also called SARS-CoV-2, and the disease it causes, COVID-19, are sweeping the globe. Coronavirus is a large family of viruses that includes the common cold. More than 100,000 people around the globe have been infected with the virus. Over 3,000 have died. It's safe to say that the coronavirus has become one of the biggest events of the 21st century. It may only be a matter of time until we see outbreaks everywhere. The virus began in China, but public health experts warn that the disease will probably start spreading in your area no matter where you are on the planet. Fear is an issue in and of itself. This is pretty scary, and the fact that it is scary is an issue in and of itself. The problem with scary things is that we aren't very good at reacting to them. Humans are awful at understanding risk. For example, turbulence in an airplane scares most of us more than almost getting into a traffic accident. This doesn't make sense when you consider that people are much more likely to die in a car crash than an airplane crash. We fear what we don't understand, and we try to control what we fear. In the case of the coronavirus, there are some pretty obvious examples of people trying to control their fears. People are reportedly panic buying everything from toilet paper to ibuprofen. Many frightened shoppers are doing this even though there is no outbreak in their local area, and stores are not at risk of running out of either product anytime soon. People are also dragging masks off pharmacy shelves like it's no tomorrow. The evidence strongly suggests that masks are a waste of time for most people. For weeks, health authorities have said that the main reason to buy a mask is if you are yourself sick. In that case, the mask stops you from spreading the virus when you cough or sneeze. Lack of evidence. Some have also started selling and buying supplements to cure the coronavirus. If we try to look at exactly what each immunity-boosting tea or pill is if we try to look at exactly why each immunity-boosting tea or pill is probably worthless, we'd be here until the end of time. There is a distinct lack of evidence that any of these supplements work. That brings us to one of the scariest parts of the coronavirus, which is perhaps what's got people on edge. Most of the recommendations are things that other people have to do: wearing masks when you're sick, staying home if you are unwell, covering your mouth and nose when you cough or sneeze, and seeking medical care early if you have symptoms. Relying on other people means not having much control over your own fate. Nobody likes this. Yes, you can wash your hands and stop touching your face, but doing these things doesn't make us feel much safer. We need everyone else to be making informed choices too. That's what this panic is really all about. People are trying to manage their fear by trying to find a small amount of control over a situation that seems to be pure chaos. Even though it's probably not going to work, we all want to be able to do something to keep ourselves from getting sick. Buying 15 tubs of hand sanitizer can make us feel better protected, even if we'd be just as well off buying a normal bar of hand soap. Scary stories have been circulating about the coronavirus, but it's important to remember that there are evidence-based steps you can take to protect yourself. The World Health Organization, WHO, studies and advises on global public health. The WHO has a series of simple tips on its website that anyone can follow. They include the following: wash your hands more often and practice not touching your face. Yes, it seems boring, but often the best advice is boring. Even if the pharmacy shelves are entirely clear of face masks and hand sanitizer, you can probably find boring old soap that'll be more useful anyway. No need to panic over pandemic. Ultimately, the most important thing to do is to not panic. People are often panic when they hear a disease described as a pandemic. Many people associate the word with the spread of serious, deadly diseases. The next time you hear this word, take a deep breath and remember that pandemic describes how a disease spreads, not how severe it is. Fear is okay. It is natural to feel afraid. Even the experts admit that there's a huge number of things about this outbreak that we don't know yet. That is scary for everyone. Still, it is important not to let fear control you. We'll probably have to live with it for a while. Gideon Meyerowitz, Katz, is an epidemiologist working in chronic diseases. The opinions in this article belong to the author and do not necessarily represent the views of News ELA or its editors. So that's our article. Let's look at our questions. So your questions are going to be on Google Forms, as they've been for all of our social studies stuff. But I'm going to read them here underneath this because it's a little bit easier to see. So question number 1 says, which sentence from the section Lack of Evidence best introduces the idea that there are simple and reliable ways to combat the coronavirus to the reader? So what sentence from the section Lack of Evidence best introduces the idea that there are simple and reliable ways to combat the coronavirus? A. Some have also started selling and buying supplements to cure the coronavirus. B. Covering your mouth and nose when you cough or sneeze and seeking medical care early if you have symptoms. C. Yes, you should wash your hands and stop touching your face, but doing these things doesn't make us feel safer. Or D. Scary stories have been circulating about the coronavirus, but it's important to remember that there are evidence-based steps you can take to help protect yourself. Number 2. How does the author build understanding of people's ability to assess risk? So how does the author build understanding of people's ability to assess risk? Is it by A, emphasizing the different risks of the coronavirus? B, by comparing risk in 2 common forms of travel? C, by explaining that panic buying can create new risks? Or D, by describing the risk of calling the coronavirus a pandemic? Number 3. Which of the following claims is least supported by logical reasons in the article? So which one is least supported? A. The World Health Organization has slowed the spread of the coronavirus. B. Fear of the coronavirus is causing people to panic buy many different products. C. There are simple steps people can take to protect themselves from the coronavirus. Or D. The coronavirus is a new disease that poses a danger to people around the world. Number 4. Read the following sentences from the article. So sentence 1. The virus began in China, but public health experts warn that the disease will probably start spreading in your area no matter where you are on the planet. 2. In the case of the coronavirus, there are some pretty obvious examples of people trying to control their fears. 3. If we tried to look at exactly why each immunity-boosting tea or pill is probably worthless, we'd be here until the end of time. And 4, even if the pharmacy shelves are completely clear of face masks and hand sanitizer, you can probably find boring old soap that's more useful anyway. So, which sentence best supports the author's point of view that people have good reason to be worried about the coronavirus? So which one best supports the author's point of view that people have a good reason to be worried? A, sentence 1, by explaining that the coronavirus can spread to any area in the world. B, sentence 2, by emphasizing that people are overreacting to the coronavirus. C, sentence 3, by stressing that many supplements are ineffective against the coronavirus. Or D, sentence 4, by showing that the best protections against the coronavirus are sold out. Alright guys, remember that you can rewind this video at any time to hear questions over again. You can pause it along the way, and I will let you guys get started. Good luck!